Hello, everyone. Welcome to this month's special edition of Ask the Experts, our live Q&A with Winona doctors and our friend and head of patient services, Joe Cullen. Yay!
Hi, everyone.
I'm going to let everybody do their normal intros, but in the meantime, everybody who is here, please go ahead and put your comments in the chat. Questions in the chat. Hopefully you don't have comments in advance of your questions unless you want to tell us all that we're great people. Please go ahead and put your questions in the chat. And then I am going to let Jo take it away and introduce herself.
All right. Well, I'm happy to be here. Thank you for the invite. Yes, I am head of patient care services. That is my main role with Winona for a little over 2 years now. And but I am a dermatology nurse practitioner by trade. I practiced for 12 years in dermatology as well as plastic surgery settings. So I have a pretty decent dermatology background and have been involved with this new skincare launch from the beginning, helping to sort of shape it and bring it to market. So I'm excited to be here and help answer any skincare questions that people might have.
Amazing. Thank you. Who else? Who's next?
You guys should go, since you're sitting there together.
He goes.
All right, so my name's Mike Green. Many of you know me. I'm OBGYN and the Chief Medical Officer of Winona. And we're really excited for the skincare launch. I got to tell you, this was a long time in the making. We talked about this before we launched Winona. So this is really over 4 years old of talking about it. And it's been 2 weeks away for the last 6 months. But we, after many iterations and many trials and many of our good Winona people trying it out until we perfected it, we've got something that we are really proud of and think is going to be really helpful for you. But and I'm going to have Joe talk a little bit more about that. But first, Kat, sign in, please.
I'm Dr. Kat Brown. I'm the medical director of Winona. I've been working with Winona since December of 2021. I think I was the first doctor other than yourself that you brought on, right, Dr. Green?
That's right.
So I mainly practice in Pennsylvania, is where I'm located, just outside the Philadelphia area. And I take care of patients in Pennsylvania and in Florida, Michigan, and Hawaii as well for our site on our platform. I'm a board certified OBGYN. I'm a mom of 3. I'm married to a professional musician. So when in my spare time, I'm trying to go support him at gigs and going to concerts and stuff like that. That's one of my loves. And I'm just dedicated to women's health. And now that I'm also perimenopausal myself, this is an interest that I'm putting a lot of time and energy into and helping myself as well as helping my patients. So that's me in a nutshell.
Yay.
By the way, you guys, please put your questions in the chat. We're really here to answer your questions. Otherwise, we're just going to be having fun and chatting together, which is not going to be a good use of it.
We have fun doing. I mean, it's the last time I saw you guys in person. It's been over 6 months now. So
we really want to answer your questions.
Right.
So please put them in. Joe, tell us a little about the skin cream that I've been bragging about.
Sure. So we just launched this past week and very excited about a skin cream that contains estradiol, which is a type of estrogen, as well as tretinoin. We paired those 2 specific ingredients because they really are, tretinoin, for example, is a mainstay in skincare, really through the lifespan. But it does come into play and is an important part of a skincare regimen as we what I call getting less young. I don't say we're getting older, we're getting less young. But the fact that we at Winona do hormone replacement therapy, it kind of made sense that we would pair an estrogen with that. And we use one of the estrogens called estradiol. Both products actually work very similarly. They both improve tone and texture. They both increase the production of collagen and elastin, which as we get less young starts to decline. And that's why we start to see fine lines and wrinkles and sagging skin. It's because the collagen and elastin, that's the building blocks of skin. That's what holds it in place and keeps us looking young. So both of those products actually work to benefit the skin in those ways. The estradiol actually unlike the tretinoin, does provide some extra hydration. So if you think about skin that's dry, you're going to see more fine lines and wrinkles. It's going to look more dull. Skin that is well hydrated is more plump and tends to glow a little bit better. So we paired those two products in a beautiful, elegant base. It's actually in what's called an anhydrous base, or waterless is the very popular term that you'll see TikToks and all of the things. And basically what that means is that instead of the product being watered down, so to speak, you're getting all of the goodness. It has to have a base somehow, some way. That's how those products, you have to have it in something to spread it. But this is a beautiful, cosmetically elegant base. It feels lovely. It has 0 scent, at least to me anyway. We don't add any extra fragrances. But it's going to be a great product for women in our demographic in all phases of menopause. If you haven't already started to see changes in your skin, you will. And this is a great product to start sooner rather than later. It's not where, at X age, you really should start this. I mean, women in their 20s start on tretinoin, usually for acne-related reasons, but it really is a great product to help improve the health of the skin. And honestly, healthy skin is glowing skin. So I think that's all I have to say about that.
Thanks, Joe.
Well, thank you. Yes, helpful. Thank you, everyone, putting your questions in the chat as well. I have more questions about skincare, but first, before we get to my questions, we are going to get to people's questions in the chat. So, Joe, and I feel like, again, Hollywood Squares, we're going to, the way that this will work is, if there's a question for you, Joe, I'm going to punt it to you, or I'll let anybody else weigh in, or maybe somebody, Dr. Cat or Dr. Green will throw it your way if it's not a them question and it's a you question. Okay? All right. So first question of the day, Brandy would like to say thank you to all of us at Winona, because she says it's been life-changing, which we love to hear. Her question is regarding hair loss. She says she's noticed an increased amount of hair loss since starting Winona, and she's on skin cream and DHEA. Thoughts?
So hair loss is a very, very common complaint. I probably get at least a message a day talking about changes in hair. And it's a bigger issue because, our bodies are responding to a lot of changes, but there is a phenomenon that we learn about in medical school called telogen effluvium, basically, which is like a fancy term that talks about how all the hair follicles kind of get reset. It can happen several times. It can happen during pregnancy, postpartum, anytime there's a sudden stressor on the body, whether we have surgery or a traumatic event, you're a bad accident, and also starting a medication like ours that might change your hormonal environment is also a big shock to the system too. So basically all your hair follicles are all timed at different points. And so you don't see a lot of hair shedding at once normally, but when you have one of these events happen and everything gets reset, those hair follicles can get reset on the same timer. And so you get more clumps in one section. You might notice more hair falling at one time than another. So it's a temporary phenomenon. It's really related to your body adjusting to the medication. And then over time, it will get better. And in general, when we add in, Joe was just talking about how beneficial estrogen is for the skin and the youth of our skin, well, the hair follicles are a part of that organ. And the skin is our largest organ in the body. And so ultimately, the longer that you're on the estrogen replacement therapy, the better your skin, your hair, your nails will look long-term. So hang in there. This is a temporary change.
Fantastic. Also, just a heads up to everybody who's in the chat on Livestorm. We also are streaming this live in Facebook. So I'm going to alternate between the Facebook and the Livestorm people. So get ready for that because there's lots of questions. One of the questions today from Facebook is from Renee. She says she started Winona in January and was wondering when will or if the bloating will go away. Dr. Green?
So bloating is a common complaint, and it can be an initial side effect from hormone replacement therapy. It can also just be a symptom of the menopause transition. So for some women, they have bloating before they start the medicine, the bloating gets better right away, which is great. Other people get it as an initial side effect, usually temporary. For most people, it's gone within the first couple of months. But if you've been on this since January and it's still happening, obviously you're not in that group. So I like to think about what's the underlying cause of bloating. So generally, there's usually three main causes from bloating. Water retention is probably the most common. Another cause can be just increased gas production in the gastrointestinal tract, and then constipation is another common thing. So the first thing to do is trying to understand what's causing my bloating, and then you try to work on that underlying cause. So if it's from water retention, increasing your fluid intake sounds backwards, but that can really help with water retention because it can help open up the kidneys, decreasing your salt intake, keeping your activity up, and you could use an over-the-counter diuretic. All those things can help if this is really sort of a water retention issue. If it's a gas issue, you can use Gas X, which is simethicone. It's an over-the-counter treatment for gas, and that you can get, just any drugstore without a prescription. You can also kind of think about the foods you're eating. Try and decrease gas-producing foods could be really helpful. And then finally,
just gonna add too. I mean, I think the standard American diet is not the best and probably causes a lot more bloating than we all think, or that we might attribute to.
Yeah, exactly. Yeah, the fatty foods, the salty foods, all those kind of things. And then finally, constipation, increasing your fluid intake will help with that. Fiber is really important. My little trick personally is carrots. So I eat a handful of carrots every day and it keeps me regular, works really well. And then you could also use a stool softener, or if you need, you could use Miralax, which is a medicine that can also help with constipation. So all those things can help. It's the idea of trying to understand what the underlying cause is, and usually that will treat it. So those are the kind of things I would think about.
Okay, thank you both for that. Okay, we have a question about oral Minoxidil and Menoestra. Am I messing these names up horribly? Forgive me.
It.
Okay, good. For hair loss, the question is about how do both of those things affect hair loss and the hormones in women who are pre or perimenopausal?
Well, you used to be primary care, right, Mike?
Yeah. Well, yeah, those didn't exist when I was primary care, but those. So for those of you who know, I did a family practice residency before I became an obstetrician, and then I really didn't like taking care of sick people, and I really loved delivering babies, and I just felt a passion for women's health. So I ended up doing a whole second residency to do OBGYN. But those medicines aren't really treating the hormonal type of hair loss, or at least the symptoms of menopause transition. Really, HRT is going to do a better job with that. Those work directly, I believe, at the hair follicle to stimulate hair growth. Joe, maybe you, because believe it or not, if you have hair problems, it's a dermatologist that you're going to go see. So there, people don't think about that, but kind of as Kat explained, hair really is part of the skin system, which is dermatology. So those medicines work really well for hair loss for some people, but they're really sort of outside the scope of, honestly, a gynecologist practice. Joe, maybe you can speak to it a little bit better than I can.
Yeah, I mean,
so.
They're prescribed in the dermatology world for hair loss, not a lot, because there are obviously some risks involved in using those medications. But what we normally find with them is it's sort of a Band-Aid approach to hair loss. Is like, yes, you could start taking them and you will usually see some improved hair growth and whatnot, but as soon as you stop them, you will see that whatever the hair loss issue was return. So, I mean, obviously hair loss that's related to hormones, if you're replacing that usually is a more long-term solution. It's honestly preferred versus those other medications.
Great. Okay, that's good. Thank you. That is super helpful. We have another question that I think either Kat or Dr. Green will be happy to answer, which is one we get sometimes. The question is, how long do you stay on HRT? Is there an increased risk the longer that you are on it?
So every woman's a little bit different as to how long she might need it. One of the things we talk about is that every woman will go through menopause, but not every woman will necessarily need to go on treatment. But so we usually do the shortest amount of time needed, for the symptoms that you have, for the, in the lowest dose. But for most women, that usually equates to being on HRT for maybe 4 or 5 years on average. Some women it's longer. If you talk to the female OBGYN community, a lot of us, you'll have to pry it out of our hands because we know all the benefits, and we don't want to stop it because there's so many good things that come from it. Really estrogen is beneficial on every tissue in our body. And so once you see the benefits and you see the protective effects it has and how good you feel on it, it's not something you necessarily want to go off. Now, as far as the risk, the longer you're on it, that's something that's individualized, I think, for each patient. So every one of us has a different medical history, a different family history. We all take different medications for other reasons. And so I think that that's something that you'd have to individually discuss with your provider to really determine, is staying on it longer than the 5 years more risky for you or not? I don't know if we can make a blanket statement necessarily about everybody and the length of HRT, but we can talk about that average, being about 5 years or so. I don't know if you want to add to that, Dr. Green.
Yeah, this is, this is something that's sort of debated and bounced around, but I think as we start better understanding the long-term benefits of HRT, I think the consensus is starting to form that it's safe to be on really as long as you need it. And like you said, some people decide that they want it forever, which is fine and reasonable. My personal feeling is, taking medicine is a hassle. And so I want to be on the least amount of medicine I need to be to take care of my health care. And so it's reasonable, I think, to try going off of it. So, after you've been on it for a few years, it's like, gee, do I still need it? And so you can just do a simple experiment by stopping it and see how you feel. And if you feel the same, then maybe you don't need it. And if you feel miserable, go back on it. Don't do that just before your kid's wedding, So you want to be smart about how you time that in case you still need it. But I think it's reasonable to do that. There's no risk to just stopping it and seeing how you feel. Some people ask, oh, do we need to wean off of this? And you really don't. You can just stop it. And if you still need it, your body will let you know. And if you don't, then you'll feel fine. And I think that's really a good way to check. And every couple of years you can do that.
If you live in a hot climate, don't choose the middle of the summer to go off of it either. Yeah. That would be really bad.
Tips from the experts, everyone. Tips from the experts. Okay, so Jamie has a question. This is for Joe. Is Retin-A comparable to the tretinoin?
Well, tretinoin is Retin-A. It's the generic form of Retin-A. There's all kinds of brand names for Retin-A. I think once upon a time there actually was a product labeled as Retin-A, a brand name, but Retin-A is tretinoin. Tretinoin is just the generic form of that. And they both come in a variety of doses, from very tiny to ones that are much higher and much stronger.
Fantastic. This is all of it helpful. Everybody, we are being educated today. I didn't know that, so thank you for myth busting on that. Sure. Okay, CB from Facebook is letting us know she has a question about, I haven't seen this before, experiencing a cortisol rush or getting the jitters when applying the HRT cream. Is this something that requires a bit of time to settle?
I don't think I've ever heard that from patients getting a cortisol rush from applying a medication. Maybe it's anxiety or nervousness about taking the medication that causes it, because I don't think the medication would necessarily cause that kind of reaction physiologically in the body.
Yeah, it doesn't get absorbed that quickly. It gets absorbed through the skin and then goes under the skin, but it takes a while for it to be taken up by the circulatory system. So it's hard to explain that from a physiologic point of view. Not that it's not happening to you, and obviously it's a real feeling for you. But I don't think it's necessarily cortisol. I think it's probably more anticipatory, as we say, in that, you're worried about it, you put it on, you kind of get yourself worked up, and then you get this feeling, and that's probably where it's coming from. My guess is, as you do this more and more, and it becomes more routine for you, that's probably going to go away.
Okay. Thank you, Dr. Green. All right. Samantha has a question. She says she just received her order today, and she's taking 25 to 50 milligrams of progesterone for several months and wants to know if her Winona cream is much stronger than that. She started with 100 milligrams progesterone, which caused weight gain and swollen breasts.
Well, so without knowing what you were prescribed by your Winona doctor, it's hard for us to say, but we prescribe progesterone in a dose that is appropriate to balance the estrogen when you have your uterus. So it's important for a woman who still has her uterus when she's starting HRT to take progesterone to protect that uterine lining. So earlier I said estrogen is beneficial in every tissue in the body, but what it does in the uterus is it makes the uterus, the lining of the uterus, grow or fluff up like a shag carpet to get ready for a pregnancy. And we don't want that. When your uterus should not be biologically active and not be preparing for anything, we want to keep it nice and thin to reduce the risk of cancer growth. So it's important that we give a progesterone dose that'll balance the estrogen out appropriately.
All right, thank you for that.
The swollen breasts and the weight gain.
Well, let me add that you should stop the other progesterone cream. Otherwise, you are going to end up with more than you need.
No double dosing, double dipping.
Double dipping.
Yeah, along those lines, I mean, I've had a few patients recently that were taking things over the counter or that they were getting something from somewhere else. And then I recommended stopping and they said, well, why can't I use both? But it's really important when you're doing our onboarding and when you're getting medications from any physician or provider that you're really transparent about everything you're taking, because we really want to make sure that what we're doing for you is safe. And if we don't know what you're taking, we can't make sure that they're not going to interact. So make sure you lay it all out on the table and let us know exactly what you're taking.
Yeah, they say the two people you should never lie to are your doctor and your lawyer.
Love it. Also probably true. I think that's legit. Okay, we have a question from Facebook, and the question is, Michelle wants to know if the constant breakthrough bleeding will ever let up or stop. So get out your crystal ball and somebody go. Kat?
Well, did she mention how long she's been on medication or anything? No, so it's hard to say. I mean, so your body, our female organs are programmed to respond to these hormones. That's how our whole reproductive system works. So when we throw in a medication that's hormonal, your body is going to respond to that. And so sometimes for some women that can equate to some bleeding that's erratic or unpredictable as your body's getting acclimated. But generally, once we get you on a good dose, that usually levels off and gets better. So, and not every woman experiences it. Some women start HRT and they do just fine and they never have any breakthrough bleeding or spotting. So every one of us is unique. We're each a special snowflake.
Please let your Winona physician know if you continue to have spotting, because that can be very important.
Mm-hmm.
Okay, we have a good question from Danette, although I think we might need some more information to answer the question. The question is, does hormone treatment interfere with a weight loss program? Will you gain weight with the treatment?
Well, so maybe temporarily, some women may notice as they're starting their HRT that they might have some changes and might notice some water retention. And we talked about the bloating earlier. That can equate to a few pounds for some women. So I usually tell them as they're getting used to the medication, just stay away from your scale. Like, forget he's your friend anymore. Just leave the scale aside. Now, long term, we're seeing more and more data in our medical journals that for women that are doing a weight loss program, specifically a weight loss medication, like our GLP-1 medications that are becoming more popular, that for women in perimenopause and menopause, if they're on one of those medications and HRT, they tend to be more successful with weight loss than taking one of them alone. So, and that's new and exciting for us because we're just learning that as we're following patients that are on these medications. So it may be, they collaborate together and you do better on both. But I think that if you're doing a program, it kind of depends on what the program is. If you're focusing on nutrition and exercise, I don't think that will be interfered with by your HRT. I mean, and that's part of, as physicians, what we counsel you to do anyway. We want you to have this as a total package of taking care of yourself. So it's important to eat well, to move your body. So that's basically, they can help each other.
Great. Okay. Let's see. Next question. Oh, it looks like, sorry, I had to scroll down and now I have to find my spot. Hold on one sec, everybody. Sorry. Everybody has lots of questions. I guess we're going to have a lot to get through today. All right. We have a question about someone who says they've had both of their ovaries removed back in April and they feel like a zombie. They don't have any emotions now and feel like they're in a tunnel. Currently on estrogen patch and 100 milligrams progesterone. They still have a uterus and have to take progesterone, and they want to know if there's a better combination.
So when you have both your ovaries out, we call that surgical menopause. And that tends to be much more severe and significant as far as symptoms go, because when people go through menopause naturally, the hormones sort of a little more gracefully decrease. The ovaries become less efficient and they make less and less hormone over time, but they're still making some in the background. When you have surgical menopause, you have both of your ovaries removed, all of a sudden overnight, boom, you've got no hormone production. And that can be really challenging. Generally, my experience is that women that go through menopause suddenly like that tend to need a much higher dose of medication. So the estrogen, the progesterone, since you still have uterus, is the appropriate medication, but you probably need a higher dose. And so that would be, depending on how long you've been on it, maybe you haven't been on it long enough for it to be working, but you're going to probably need to push the dose to overcome the symptoms because you aren't getting any contribution from ovaries. So that's probably where the issue is.
Okay, we have another question from our Facebook side of things. And thank you to Rose and Diane, who are helping monitor all the comments coming through. It takes a village, everybody. So the next question is from Carrie. She says, is it safe to take progesterone when you've had your uterus removed because of a total hysterectomy?
Well, it's really not necessarily needed. So when it comes to our female hormones, estrogen is the bigger player in helping to combat a lot of the symptoms of perimenopause and menopause. So it's usually we use the progesterone simply to counterbalance that estrogen effect on the uterine lining. So without that uterine lining being there, you really don't need the extra medication. Like Dr. Green mentioned earlier, like who doesn't like to take medications? Like why take something additional that you don't have to take? Now, I do have some women occasionally that maybe were on progesterone previously and maybe help with their sleep a lot because it can make you drowsy. And so they want to stay on it. And so, that's something that we have to come to a decision about together. If you've had your uterus removed and you still want to think about doing progesterone, we can talk about the risks and benefits. But there's data out there that if you don't need the progesterone, because you don't have your uterus, that it can increase your risk for other problems long term. So why take a medication you don't necessarily need?
That is legit advice. Thank you, Kat. Okay, question from Karen. She says she's 52 and in perimenopause and began using Divigel. I don't know if I'm saying that correctly. 0.25 milligrams just 6 days ago and is going to start progesterone capsules cyclically, vaginally in a couple of days, but wants to understand the options for progesterone cream and how that will differ from the capsule vaginally. She wants to avoid any oral form as she doesn't do well on oral meds.
So I personally don't think that the vaginal progesterone capsules is a great idea. I don't know that there's great data that it provides uterine, that provides the balance to the uterine lining that Dr. Kat's been talking about. And so the absorption is going to be not not necessarily as good or as predictable through the vaginal route, especially through a vaginal capsule. So to me, I don't think it's a great way to do it. The cream there is very good data that when done properly, the progesterone cream does absorb well and does get to the uterine lining enough to protect it from getting overstimulated by the estrogen. So the progesterone is a much bigger molecule than estrogen, so it does absorb a little bit slower and less efficiently than estrogen. But when micronized progesterone is used and used in the correct dose, it works very well. So if you want to avoid oral estrogen, I think it's a lot safer and probably a lot better for you to use a progesterone that's absorbed through the skin rather than the vaginal capsules. That's my 2 cents. It's probably a somewhat controversial statement, but I think it's pretty much backed by the data.
All right. We have a question from Laura in the Facebook group that says, so many women ask on the Winona Women's page if they need to switch the areas they put on the Bi-Est cream. Can you speak on this?
So, I mean, generally what we recommend is that you apply it to an area of the skin that does not have hair. And that's basically because we don't want it to be in the hair follicle. So most women will use the inner forearms, some women use the back of the knees or the inner thighs. But as long as the cream is rubbing in well, as long as you're getting a therapeutic effect from it, you don't necessarily have to rotate like from forearms to back of the knees and have like a schedule that's regimented. It's not really recommended. You have to do what works.
We actually recommend doing that for the patch, and that's because the adhesive in the patch can be really irritating to the skin. So you do want to actually move that around, but there's no adhesive in the cream, so you don't have the same problem there. Sorry to interrupt.
No, that's good.
Tips, you're getting it from the experts right here. Keep going.
Yeah. So I think that the other thing that's important about medication is that you have to choose a method that is easy for you to incorporate into your day-to-day life. So we can talk all day about what we think is best, but if you can't fit it into your day-to-day schedule and you're not going to remember to take it, then you're not going to use it. And so anything that makes a medication more complicated, the more times you have to apply it, the more times you have to rotate it, like there's more chances for error and forgetting and to just not be using it. So pick something that's simple and just keep using it.
Awesome. Okay, we have a favorite question. I know both of you are going to be excited. The question is from Deborah, and the question is, do you consider blood tests prior to prescription?
I knew that was going to be the question.
Here it is.
It's always the question. And the answer is it's not needed. So blood tests are really, when it comes to female hormones, our female hormones are so erratic. They're released in a pulsatile fashion. A woman could be suffering from hot flashes and night sweats horribly, but then the day she goes to the lab, her ovaries decide to kick it in one more time and throw out some good hormones. And that one day they could turn out totally normal. So it's like a snapshot in time that does not give us the big picture about what's happening in your body. So when it comes to HRT, it's better to treat based on symptoms, not one day, one time of a blood test. And also, while we're at it, can I just go on and just add in that please do not do salivary hormone testing, dried urine hormone testing. None of this has been validated. None of it's recommended. There's a guy who has his PhD who invented the Dutch hormone test. It's making a shit ton of money off of so many desperate women looking for relief. And it's never been validated by the medical community, ever. He's just profiting very highly. I think the lowest charge I've seen online for a Dutch hormone test is like $800. Out of pocket, not covered by insurance because it's not a valid test that's recognized by the medical community. So please don't waste your money on these things, ladies. It's not needed. It really is not needed. So we all smile because we've heard all these things from patients so much. Joe, you probably field a lot of these questions on a regular basis about why is the doctor not looking at my labs? Why are they not adjusting my dose based on labs? Because the labs are just not important to us. What's more important to me as your doctor is how do you feel? How are you responding to the medications?
Right. Well, I'll just add that I didn't say in my intro that I too, first and foremost, was a Winona patient before I became a Winona employee. So I didn't have any tests. I got prescribed. I have been on treatment for it's been since March of 22. Yeah. And beautiful. So.
Yeah, I'll tell you what gets me going is we see so many patients that are suffering with all these symptoms, and they go to their doctor, and their doctor does a test because they don't know better, and the test happens, it comes back normal, and they tell them, oh, it's not from your hormones, and they dismiss them. And then they finally come to us, and we get them on the right treatment, and their whole life has changed. And it's upsetting to me that the women are being dismissed that way.
Mm-hmm.
I don't think necessarily by ill will. I think it's really ignorance that the doctor doesn't understand the right way to do this, and have bought into this whole lab thing, which just makes no real sense. So please don't waste your time and money on labs. It's really not helpful and not necessary.
Mm-hmm.
I can tell my own anecdote, because I, as a board certified OBGYN physician, know this, have studied this, but I didn't want to prescribe for myself, and I didn't want to just ask a friend to prescribe for me. I wanted to do things the right way. So I went to my family doctor several years ago and said, hey, after I had a hysterectomy personally, but I kept my ovaries. But after my surgery, I started to notice symptoms. And I went to her and I said, look, I'm starting to have hot flashes. I cannot tolerate being in the kitchen when anybody's cooking, because I'm about to overheat. In the middle of Thanksgiving dinner in Philadelphia, I'm going outside in the cold without a coat on, to wave my shirt up and down. And she said, well, we need to do labs. I said, but why? Why do we need to do labs? Because all my journals say we don't need labs, and all my textbooks say we don't need labs. This is the way I do things. And of course, it came back normal. My follicle stimulating hormone came back normal. And she said, sorry, come back and see me when you're really suffering in about 5 years, 10 years. I'm like, okay.
Oh, no.
So, if I, as a physician, talking to a fellow physician who's a colleague, who's a peer of mine, don't feel listened to, don't feel heard, I can only imagine what poor women across the country are suffering with. So, it's unfortunate, but hopefully the more relief we give patients and the more their physicians watch them, hopefully we'll change their hearts and minds, and they'll start to open their minds up a little bit more, and more women will get help.
Yeah. Well, plus people maybe don't know this, but Winona, you guys are not just physicians that are here. You're actual experts in menopause. So just because you're going to your local gyno doesn't make them an expert, but you guys are. So I think, people in the chat know that, or if you don't know that, you should know that, because everybody here is at the top of their game, and this is what they do, is just, obviously you're talented and do other things as well, but this is your specialty. So, take that into consideration. Okay. Danielle, she says her prescription has been placed, but she hasn't received the patch and progesterone yet. And she's been experiencing a lot of hair loss in the shower over the past year. And her main concern is stopping the hair loss. She thought that taking HRT would help, and she's concerned about hearing others experiencing hair loss, which is what she's trying to stop.
So Kat already talked about some of the effects, but this is a long-term game. So skin and hair and weight, I think, are probably the three big ones, particularly hair and weight. They take a long time. So don't expect to get your patch and your progesterone and in 2 weeks, all of a sudden your hair starts growing back in. It's not going to be like that. It's going to take a while. Part of it has to do with the nature of the way hair cycles. So anything involving hair takes a long time to really appreciate results. So most women, if they stick with it, do see improvement in hair. And you hear on the Facebook group and stuff, these frustrations of people that get this initial hair loss. And it's not sort of real hair loss. It's what they would have experienced anyway. It's just all happening at once. But over the long term, you can expect, if you stick with it, to get improvement in your hair. But it's really a long run game. This is not a sprint. Unfortunately, I wish it was. That'd be great, but it's just not the way the physiology works with hair growth and hair follicles.
Mm-hmm. All right. Look at Joe's hair. Joe has amazing hair. She's on HRT. She's a long game. Just saying. So, okay, Linda says, Linda's just making a comment that she takes estrogen, progesterone to help keep things in balance. That's very smart. Jessica says she's 49 in perimenopause and is losing a lot of hair. Here we go. She just did an assessment to get the lotion, and she wants to know if we think this will help her hair loss. And she's about to take Life Extension Estrogen for Women herbal products. Okay, thoughts?
My first thought is if you're taking a supplement that's estrogen for women, we need to know that if we're prescribing you medication. So make sure that you're cross-checking and letting your Winona doctor know, that you're taking something else over the counter. There are some over-the-counter estrogen-like products and things that have phytoestrogens in them that it's important for us to know, because if you take them in high enough amounts, it can interfere with your medication and you could be getting too high of a dose. But like we talked about earlier, so this is the theme tonight, skin and hair. Everyone's really concerned about hair tonight. But yes, long term, if we supplement your estrogen, your hair growth will get better over time.
I love it. It's because Joe's here. She's bringing in all the hair and skin people. Energetically, we'll chat to send in their hair questions and their skin questions. I see Ashley in the chat too. Ash, we're going to get to your questions as well if you're still here. I promise. If you just left your questions, that's also fine. We'll still get to them.
You don't have to be present to win.
Yeah. There's the small print on the sweepstakes for today. Jamie says she just wants to make sure hair medicine won't mess with hormones or cause issues with hormones. I'm not sure.
Was that the question earlier with minoxidil?
They're safe to take together. There shouldn't be any negative interactions. You're okay.
Okay. Okay, a good question. Carla is wanting to know how long after menopause should a woman remain on HRT? And then she's asking, secondly, to age 60? So feel free to jump in on that.
Well, we talked about earlier the average length that women are taking HRT, and we talked about, when you feel like you want to try to stop it, you certainly can. It's safe to stop it, but the age 60 rule is when you start the medication. You don't have to end by age 60. So, it's safest for us to start your HRT before you turn 60. But if you've already been on it and that 60th birthday comes, it's perfectly safe to continue if you're feeling well on the medication.
Okay, we have a Facebook question from Maureen. She says she's taking the 50/50 cream and DHEA capsules for 4 weeks, and she's having symptoms of itching and rashes, and that her eczema has been triggered, and she's feeling bloated too.
Did she say how long she's been on it?
4 weeks, I think.
1 month. 4 weeks, yeah.
Gotcha. So, this could be your skin responding, but if you're getting a rash in the distribution where you're specifically applying the cream, let your doctor know. Because we try to select ingredients that are hypoallergenic, that aren't going to respond, but everybody's body is different. And so if you're getting a rash in the location specifically where you're putting your cream, we might want to rethink which method you're using so that you don't have that reaction. But the bloating we talked about earlier, that's something that's temporary. It's your body adjusting to the medication. My kids are playing video games in the other room and they're getting really loud. So I'm going to go on mute for a second and I'm going to go tell them they need to simmer down. I hope you guys can't hear them. They're getting really intense.
Just a little, but it's all good.
Yeah.
You go deal with that.
Yeah, I'm glad I'm not on the other end playing with them, across the internet.
You're going to be getting that.
They're talking about my mom and stuff.
Get the slap down, smack down. Okay, Mandy is letting us know that she's having her digestive system upset. She wants to know if it's common when a person first starts with HRT, and she says she's 2 weeks in and her digestion is out of whack. No other real changes except starting estradiol patch and DHEA, and she's starting to sleep better and maybe having a little mood improvement already, and she's happy about that.
So the DHEA, since you're taking it orally, can sometimes affect the gastrointestinal tract. I'm not exactly sure what issues you're having, and that usually gets better pretty quickly. Estrogen can also affect the GI tract. That was kind of the bloating stuff we're talking about. And that's another thing that tends to get better with time. So depending on what problems you're having, if every time you take a DHEA, you're getting really nauseous and throwing up, then maybe we need to rethink the DHEA and maybe upsetting your stomach. But otherwise, these are the kind of things that the body tends to adjust to and get better with time. So I'd say try and hang in there. You can treat whatever's going on symptomatically. So if you're having, diarrhea, you can use Imodium. If you're having gas, you can use Gas-X. If you're having constipation, we talked about the different strategies for that. So it's fine to use sort of symptomatic over-the-counter treatments to counteract. If you're having heartburn, using Tums. So my heartburn trick is Tums and Pepcid at the same time. Tums works right away, and then it wears off in about 45 minutes. By then the Pepcid's kicked in, and you have relief for the next 12 hours. So that's my little favorite cocktail. Plus, Tums is a great source of calcium. So you might consider taking a Tums every day anyway, just to get your extra calcium. But so I'm not sure what your digestive issues are, but those are all ways to think about it.
The Tums is a legit tip, so keep it in mind, friends. Okay, Karen says, is it okay to take only 100 milligrams of progesterone, permetrium capsules cyclically with 0.25 milligrams of estradiol, Divigel, or do I need to take 200 milligrams of progesterone if I'm only taking 12 to 14 days per cycle?
So 100 milligrams is probably okay. Cyclical progesterone is not recommended. This was an older idea, kind of got popular about 15 years ago, and it had to do with data that came out that, interesting, estrogen alone does not increase breast cancer risk, but estrogen and progesterone has a slight increased risk. So people thought, well, gee, maybe if we decrease the progesterone exposure, we can decrease the risk, and it turned out it really worked that way. And so cyclical progesterone really gives you no advantage, but it tends to cause more side effects, and it's harder to do. As Dr. Kat was saying earlier, you want to be on the simplest regimen possible to make it easier for yourself. And so it's actually better to take progesterone every day than to take it cyclically. So I can tell by what you're on that you're not on a Winona regimen, so you're going to have to talk to your doctor about that. And everybody's kind of got their own way of doing things, and not everybody is up on the latest literature, unfortunately. So, but this idea of taking estrogen only 12 or 14 days out of the cycle is kind of an old concept. There are very occasional times when that can be helpful, particularly if there's bleeding issues, but for the most part, it's really not the best way to do it. But 100 milligrams should be enough to protect your uterus.
Okay, great. Danielle has a question. She says, aside from individual preferred methods, what are the pros and cons of progesterone in the cream versus the pill?
I'm sorry, can you repeat her question?
Yes. Okay.
You're still thinking about the smacking you gave your kids.
Kat's just coming back into the picture, getting...
I had to just give them a talk. I'm like, if you don't quiet down, I said, all the people on the internet watching my webinar can hear you yelling in the background.
They were like, good, mission accomplished. Okay. The question is, what are the pros and cons of progesterone in the cream versus the pill?
Well, so, for me, I think for most patients, it's the ease of being able to apply one medication rather than to split it into two. And so, we talked earlier, Dr. Green mentioned that the progesterone molecule is a little larger. And so, we have to make sure we give you an adequate dose of that to get through the skin barrier. But a lot of our patients do really, really well with the combination HRT cream. Now, if you're a patient who is real sensitive to the individual components of the different medications, or maybe you were on an oral progesterone and you took it at bedtime and it gave you great sleep, I do have some patients that want to go back or want to stay on oral progesterone, that they're really just tied to it. And so, I've had some patients that requested that way. So it's really your preference. But I think for ease of application, why not put both medications in one cream and just apply it once a day? I think it's a lot easier than splitting it.
There's also a financial thing. I'm cheap, so all my stuff is like Kirkland brand and that kind of thing. But when we combine, the cream is the same price, whether it's estrogen only or estrogen and progesterone combined. So if you split out the progesterone and take it as a pill, you have to pay for that pill. So it saves you money putting it in the same cream, which to me is always a bonus as well. And not just for me personally, but we like to try and make this as economically easy for you as possible. And so that is the most economical way of doing it.
Dr. Green, we're going to forgive you for the Costco part. As long as you aren't buying your pants there, then we are good to go. You are buying your
pants there.
Costco?
Hey, what's wrong with that?
Costco has great stuff, actually. I got Calvin Klein jeans at Costco for a sale. alcohol.
My wardrobe comes from
Don't
Costco. I've just been Costco shamed.
Hey, I do too. I mean, it's great. You can get your milk, your eggs, and like a new outfit at the same time.
I mean, I don't know. Are you going Kirkland brand or are you going like brand?
I find Tommy Bahama there, Calvin Klein for a steal.
There's a brand, 32 degree.
Oh yeah, their stuff is good too.
See, sorry, we're going down a rabbit hole here. Okay, back to the topic at hand, which is you all in the chat and your questions.
And the Costco alcohol is pretty bomb.
Oh, we don't have that benefit in Pennsylvania, unfortunately.
It's not happening. I don't like. Does Pennsylvania have? You probably have separate rules for
your ABC.
We do. Like, so grocery stores can have a section that's wine and spirits, but it's like wine and beer.
Not alcohol.
No. And then when I lived in North Carolina, you can't buy alcohol before a certain time of day. You had to wait until like a certain time. I think on Sundays you had to wait till afternoon in the grocery store. But yeah, it's interesting. There's laws. Every state I've lived in. I was in the Army, for some of you that don't know, if you haven't checked out my bio on the website. I was in the Army for 12 years, so I've bounced around quite a bit. Grew up in Pennsylvania, lived in Hawaii, North Carolina, Texas, now back to Pennsylvania. But yeah, I miss that. I miss the alcohol at Costco.
There are no laws out here in California. You just come on out.
You can buy anything in California.
That's it. Wild West out here. Come on out, Kat. Okay, Brandy is asking. Well, here's a good question. We get this one a lot. So if this is your age demo, pay attention. Brandy's asking us, once I turn 60, she understands that she may not be able to get HRT from Winona anymore. Is this true? And if so, why is this the cutoff?
Well, it's the cutoff for starting. So even if you're 59 and a half, you could still start with us. But really, it's
264 days. Come on down.
Right. But if you're over the age of 60 and you want to consider HRT, maybe you've been on it before, maybe you haven't, really you're in a higher risk demographic. And so it would be better for you to get medication the traditional way and have a full exam, have somebody be able to see you in person, just because you're no longer, low risk for starting therapy after that age. It doesn't mean you can't use it. And there's actually some benefits, especially for vaginal estrogen cream for a lot of women that might not be candidates for systemic HRT. They could really benefit from vaginal estrogen. But for those of you that are over 60 wanting to start de novo on a new HRT regimen, unfortunately, you wouldn't be able to do that with us. So you want to see an in-person menopause specialist.
Well, let me say, we're not cutting you off at 60. So if you're on it, you turn 60, you can stay on it as long as you need it to help your symptoms. So it's not like we cut you off once you turn 60. So
we're not ageist. We're just your health.
We're just trying to do things safely, but it's safe to remain on them after 60. It's just starting them for the first time.
That's it. All right. Sorry, Ashley, I skipped your question and I am so sorry. That was not on purpose. Okay, Ashley, a really good question. And Joe, this one's for you. What sunscreens should she use with the tretinoin?
Well, I have my own personal preference. I'm not going to talk about brands per se, but everybody sees like the labeling for sunscreens. Broad spectrum sunscrreen is great. But there are two different ways to protect yourself with sunscreen. There are physical blockers, which are zinc oxide and titanium dioxide, and then there are chemical blockers. Most sunscreens actually contain a combination of both physical and chemical, but people are starting to get away from some of the chemicals for obvious reasons and then some other reasons, but you will see your sunscreens that are labeled mineral. Those can either contain the zinc and the titanium, or even just sometimes just zinc. That is honestly my preference, just because I feel like some of the sunscreens, some of them are not reef safe. So for those of you who are concerned about that, they're not reef safe. So if you use them and you go in the water, contaminating the water. But more importantly, like people who have melasma, and this can be an issue being on hormone therapy. Some people will have an instance of melasma. They may have seen that if they were on birth control previously. Any sun exposure will cause little, black patches, or they get it here, sometimes in their cheeks. the chemical sunscreens actually absorb the heat and light to protect you. They still protect, they absorb the heat and the light. And in the skin, the melanocytes that give our skin color, they get stimulated by that heat and that light. And that's when they show themselves in the form of discoloration. The physical blockers actually physically protect. It's almost like a wall, if you will, to protect against the damage. So in terms of whether you're on hormone replacement therapy or hormone therapy or anything, my personal preference is a mineral-based sunscreen that either has zinc oxide and or titanium dioxide in it.
That is legit. And also, I just want to add to this for myself. That happens if you're someone who spent all your time in the sun. I'm talking to you, Gen X people in the chat or older. If you are someone who used to put baby oil on yourself and go outside with no SPF like a fool, then this message is for you, because my skin does what you just said, which is get all of this, all the splotchiness and all of that comes to the surface, and I have no choice but to use titanium dioxide and zinc oxide. And if I find even the super I love, it's a great primer, doesn't do anything for this other stuff. So when I'm on vacation and everybody's all like by the pool, they look all good under the sun, and I'm like, oh God, because your face just goes. So this is really good advice. And for people in the chat, like I said, if this was you.
Yeah. Can I add to that too, just to say that, I mean, it is important to use a sunscreen if you are using a product that contains tretinoin, because basically it's removing the dead skin cells. And so when you don't have layers and layers of dead skin cells, you have fresh, glowing skin, you are more susceptible to get a sunburn. You should be protecting yourself with sunscreen every day, because it's really the number one way to prevent the signs of aging. Sun damage, my son is gone, is really the number one cause for aging skin.
The other thing too, I mean, I spend a lot of time in the garden. That's one of my biggest hobbies. Don't underestimate the value of a nice big hat for blocking and physically blocking the sun too. I mean, use the sunscreen for sure, but if you really want to keep that youthful glow and you want to keep your skin quality good, keep your face covered when you're at the beach or when you're outside, right?
We're laughing because she just gave me a Winona swag, big old hat for fishing.
Oh, nice.
Where's my hat?
When we answer this next question, I'm going to go get the visual. So you just hold on a second. Okay.
There we go.
We have another question. The question is, Linda is asking, does Winona do testosterone cream or injections? I think that's an easy one. Who wants to take it?
I can take it. So go get the hat. I want to see it. So testosterone in the United States is considered a controlled substance because it is very widely abused by the bodybuilding community. As an Army doctor, I saw it very widely abused by our soldiers as well. A lot of men would abuse it for being able to lift more, run faster. When I was stationed in North Carolina, our special forces population took testosterone like crazy. And I became acutely aware of it because they all came in with infertility problems because their wives couldn't get pregnant. But anyway, testosterone is a controlled substance. Because of that, we can't prescribe it via telemedicine. So unfortunately, we can't do that through our platform. But the way we do get around that and trying to help increase your testosterone naturally is by prescribing DHEA, which is a hormone supplement. It's a precursor hormone, basically, that when your body ingests it, it gets broken down into estrogen and testosterone. So it's a gentle way to naturally boost your testosterone levels without actually prescribing you testosterone. So that's the way we get around it.
Let me just say that I am aware, for those of you in Florida, that Florida has its own rules, and we probably could prescribe it in Florida, but what we've decided is to abide by the strictest of the states that we serve. I think it's in my car. I just realized. Yeah.
Oh no!
I left it in my car.
I was like, I don't see it on the box.
So, there are a few states that theoretically we could prescribe it, but we want to be consistent, and so we follow the strictest rules, and we want to be in compliance with all the state and federal rules.
And the other thing too is that for testosterone treatment, we have a very narrow therapeutic index for women. So it can be really easy to give you masculinizing side effects by prescribing you testosterone. And that's something that we really don't want to do for our patients, because we really just want to help you. We don't want to cause you any harm. But if you take testosterone in too high of a level, you can actually get male pattern balding. You can get facial hair growth, chest hair growth. Your voice can change. So we don't want to cause any of those problems either. So.
Yeah, I don't think anybody here is signing up for those. I mean, maybe, but I would say probably not.
No, I won't judge.
Oh my gosh. Okay. Well, I swear there was a question on here. All right, it's fine. We'll go to this one. I had a Facebook question, but it has somehow disappeared. The question is from Jessica. She wants to know, can doing microneedling help? And is it safe to do while taking Winona?
I don't know what microneedling is.
You don't either.
Joe,
Is that a derm
that's
thing?
a Joe question.
That's a derm
That's why we have Joe here.
Yes. No, microneedling is actually a fabulous procedure with regards to if you're taking body cream or pills for hormone replacement therapy. I'll defer to Dr. Dr. Green, but if you're speaking specifically about our face cream with the estradiol and the tretinoin, you can, but typically, and you check with the person who's doing the microneedling. I have done microneedling before, and typically we would tell patients to stop using it about a week prior. And the reason for that is microneedling is an invasive procedure. It's just basically a bunch of little needles that stimulates collagen and elastin production as well. But if you've got tretinoin on board, that can be a little bit irritating. The microneedling is an irritating procedure, so you're going to wind up probably not being as tolerant of the procedure. You might have a lot more redness. Your recovery time might be a little bit longer. So the recommendation is, but again, check with the person doing the procedure, is about stopping a week before. But then once they clear you, usually is about 2 days before you can use any and all products. You have to just kind of limit that. And then you return back to your regular scheduled skincare regimen. You should be able to restart it with no problem.
So that doesn't sound like a good sell to me. Is that like a new version of like a microdermabrasion that people were all doing before? Is it causing like microtrauma to cause healing in the skin? Okay.
Correct. Exactly. That's
And it's not
exactly.
medicated, right? It's just little teeny needles.
No, they just poke.
It's little teeny tiny needles, a little handheld device.
Yeah, there wouldn't be any problem with HRT in that. But
No, I
yeah,
couldn't say that, but
It
no.
doesn't sound fun at all.
So
But
everyone,
no, it's not horrible. You typically get one for it, but it's a great procedure.
Joe's having a hard time even getting me to get sunscreen on. You think I'm going to let her stick needles in my skin?
no, everybody
Microneedling
wants
for
to
sure.
give a doctor a gift.
Yeah.
Microneedling is the gift for Dr. Green and maybe for Kat. That's the way to go. Gift cards, everybody. Gift cards. Kidding. All right. So Danette has a question about oral medication. She wants to know, if you forget to take it for a day, should you just resume taking it without doubling up on it? Question.
Yes. No need to double up on it. Just start taking it when you remember. And if you remember, if you normally take it in the morning and you remember in the evening, you can certainly take it then, or you can wait till the following day. But just remember when you remember that you forgot it. But as we all get unyoung, is that what you said earlier, Joe? Is we're not
less young. Getting
less young.
Less young.
One of the things that I do that has made my life easier, I even do it for my kids' medication, is I get one of those good old-fashioned pill boxes. It has like Sunday, Monday, Tuesday, Wednesday, because honestly, we are all so busy and we're always doing many things in our lives that it's really easy to say, like, did I take it? Did I not? So if you put it in one of those pill boxes, you know if you've taken it, if you've taken that slot.
Pull it up. It's like your 87. It's like your grandpa's house, right? Where they
Oh, now you can get one that's totally blinged out. You can get them that are stylish. You can get them in a Vera Bradley case. You can
You're
get
not
them in
just
a
buying
Louis
them
case.
from Costco over here.
We got to sell Winona pill cases. See, there
There you go.
Oh,
Winona.
no. That's our new swag. There you go.
If you're in the chat still, we got to put it in the swag store. Winona pill box. It's the new swag. We have a good question for you, Joe. It is from Janae. She's asking, can the tretinoin help with sebaceous hyperplasia?
It can actually, yes. Yeah, because it helps to reduce pore size. It depends on the size of them, though. I mean, if they're teeny tiny, It may reduce them a little bit, probably won't make them go away entirely. But the good news is it will likely prevent future ones from coming. But larger ones that you can really see, ideally, with germs, often super simple procedure to zap them with a little electrocautery, and they shrink right up. So,
Joe, is there a lay term for that?
for what? Sebaceous hyperplasia? Just a super enlarged pore. Usually you can see it at the surface of the skin, and it's usually palpable. Unlike, like a lot of times through the nose and the cheeks, you can start to see pore sizes enlarging. It looks, and it has some height to it, and you can usually feel them there. And they have usually a little pink tinge to them. They're a little pinker than the surrounding skin.
I have a question for you since we're talking about pore size.
Sure.
Back when we were all teenagers, remember those like nose strips that were so popular, the Biore?
They're still out. They're still out.
I've heard that they're horrible for you, like to do that. Like basically you put this thing on and it's like a glue Band-Aid, and then you put it on when it's wet, and then you pull it off when it's dry, and it was so satisfying to see all these little like contents of your pore that get pulled out by that sticky stuff. Yep. But I heard from people that it's bad to do that though. Is it?
I honestly can't. I can't say one way or another.
Okay.
But think about this. It probably is beneficial, because if you think about this, if you're not doing something to help with the skin cell turnover and to reduce like the buildup, you get skin cells and sebum and everything in there. And if you're not getting that out, think about like it's an opening, if you will, and say it's like this, and then it fills.
Oh,
so as long as that buildup continues to happen, the pore size will get larger and larger. So doing things using a Biore strip wouldn't be high on my list. There are other procedures that probably cost a little more. But again, tretinoin. I mean, if you're using a tretinoin product, you are turning over skin cells. You are helping to remove the debris in the pores. So that's going to be my number one starting point for that, and probably skip the Biore.
I love it. Okay, we have, how many more questions we got? 3, 4, 5. We got 5 more questions, everybody. We're hanging in. We're almost done. Okay, Jamie says she gets her hormones checked a few times a year, and sometimes she has extremely super low estrogen, and sometimes she has average. It varies. Low testosterone and other labs are normal. Her doctors say she's not in menopause, but cannot figure out why she only has estrogen occasionally. She's 44 and also only gets a few menstrual cycles a year. She wants to know if we have any thoughts that this has been going on for years, and that her gyno and family doc, referred her to endocrinology.
So my thought is stop doing the test.
Yes. No, instead, let's upload our symptom tracker that we like to give patients.
Oh yeah, hold please. Hold
Yeah.
on. I'll get it. Give me a sec.
So, like we talked about earlier, tests are just not helpful, and you're the perfect example. Like, she just reiterated my explanation of how erratic our hormones are and how some days they might be great. Like, as if the ovaries could think and could talk themselves. They're saying, like, one day, like, oh, let's go ahead and throw out some good hormone today. Like, you might have a good day where you get your labs done, and other days it's not good. But looking at your symptoms and tracking your symptoms over time is much more beneficial to us to figure out what you need. And unfortunately, labs can't tell you if you're menopausal. Not until it's after, done and gone. Then your follicle stimulating hormone will be elevated. But by then, you've already been suffering for way too long.
Okay, good advice. And Jennifer has a question. This is sort of a skin related thing, but we're going to put it to the group, okay? So Jennifer asks, is the itching symptom, her scalp specifically, when starting the cream and DHEA normal? So she's
I don't hear that very often, like itching scalp, but I can say that, like, for some women that take the DHEA, your skin can become more oily, your scalp may build up more oil. And so you might notice like that. I mean, the itching could be a response to that. Maybe if you were used to having a more dry scalp, it could be your body responding to that, but that's just a guess.
Okay, Karen had a question earlier about progesterone, and I'm not sure, I don't remember the details on this, but she's asking if she were to switch to do the cream instead, what would be a recommended dosage? And she was asking if she could still do progesterone cream for 12 to 14 days.
You could, but I wouldn't recommend it for all the reasons we talked about before. So doing progesterone for just half a month or 12 to 14 days gives you really no benefit and increases side effects. So it's not a recommended way to do it. Can it be done safely? Absolutely. And you know, my philosophy is that I'm not going to tell you what to do. I'm not going to prescribe you something that I think is harmful or dangerous to you. But if there's, you know, a way that's safe, and even if I don't think it's really the best, but it's still acceptable, and that's after explaining it to you and educating you, that's still what you want to do, then that's okay, because you're the one that ultimately, it's your body, and you know, you're the one that has to sort of do it and decide if you want to do a more inconvenient thing that potentially has more side effects. But so if you were my patient and that after a conversation, that's what you really wanted to do, yeah, we could do a progesterone cream for 12 to 14 days. I wouldn't recommend it, but ultimately I would prescribe it that way if that's was your first desire.
Okay. Thank you, Dr. Green. Okay, 3 left, everybody. Carrie in the Facebook group says, does a higher dose of estrogen help with bone density? My favorite question. She's worried that the damage is already done because she waited and is really just now being educated about this thanks to us. Well, we're happy to hear that. She's shattered 4 bones, was in her 30s when she had her full hysterectomy, and is now 49 years old. So she just wants to know if that higher dose of estrogen will help with bone density.
I mean, if her bone fractures are from osteoporosis, estrogen will help, but there's really more medication than that she should be on. There's some very specific medications that work really well for osteoporosis. And they can be used also with estrogen. So estrogen can be part of the answer, but if she's breaking bones because her bone mineral density is so low, she probably ought to be on one of these other medicines as well. Mm-hmm. So that's a really important thing. The other is that if you had both your ovaries removed 19 years ago and haven't been on hormone replacement therapy, then it may be a little bit late to start because it will increase your risk. So that's something that you want to talk to your doctor about and kind of figure out what's going to be the right answer for you.
Right. So this is like a Boniva or a Fosamax kind of thing that you're inadvertently mentioning, yes?
Right, exactly.
Got it. Okay, good. I say it. I have old lady bones too, everybody.
Diphosphonates, isn't that the class?
Yes. Mm-hmm.
I pulled that one out, huh?
Bisphosphonates, yeah.
Bisphosphonates, okay, well, yeah, I mispronounced it.
You're close.
You knew what you
right
meant.
in my head.
You knew what you meant. It's okay. All right, so Mickey Lees says she was told she has a thickening uterus and she's 54 and is menopausal. She says they've done a biopsy 2 years ago and wanted to do another one, and she's currently on a compound 50-50, I'm assuming cream, and DHEA. She wants to know if she should stop taking these. She's having the worst time trying to understand what's best for her.
Well, I guess I have more questions to really answer that. So it's hard to know. I mean, so it's really important to make sure you're taking progesterone along with the estrogen that you're taking. If you're taking DHEA in a compounded cream, maybe you're our patient. So I would pose the same question to your Winona doctor, because they have the benefit of seeing your medical history that you filled out for us in onboarding, and they can have that direct patient conversation with you specifically about you. So I think that if you have a thickened endometrium, and that's something that was recently found, you absolutely need to let your Winona doctor know, because we want to know that. We want to make sure that we're taking care of you appropriately. So make sure you message them if you are one of our patients.
Okay. I believe we have.
And if your in-person doctor is recommending another biopsy, by all means, please do the biopsy. That's important.
Hey, don't say those internet doctors told me not to do what you're telling me to do. Absolutely listen to your doctor.
Always listen to your doctor. Okay, Megan, unless they tell you that you're not really in menopause and you don't need care or support, then you can ignore that. You come to Winona. Megan says, is there any estimation of time in relation to taking HRT and seeing weight loss? The question of the day, hour, year that we get all the time. As a habitual strength trainer and active mom, the hit of seemingly overnight weight gain has been frustrating. We hear you. Okay, so which one of you wants to go on this?
I can take this one. So in my experience, the sweet spot tends to be 4 to 6 months for most women, once we get your hormones optimized. But the other really important thing too is if you're doing strength training, that's great. You have to make sure you're getting enough protein in your diet. That is a huge piece I think so many women are missing because we're thinking about calories, and calories are not the same. You need to think more about macronutrients. You need to think about fiber and protein and fats and carbs. Not that carbs are bad, but it's all about making better choices. And when I really did a deep dive for myself going into perimenopause, and I tracked what I was eating in an entire day, I was getting a grossly, too low amount of protein, not enough protein. And if you're not getting enough protein to maintain your muscles and to really maintain your physical strength, your body's going to hold on to every calorie you eat, no matter how healthy and no matter what the caloric density of your foods is. So you need to make sure you get enough protein in. If you're a vegetarian or you have trouble getting protein in, there's a lot of other options out there. I do Fairlife protein shakes, which are great. They have anywhere between 30 grams of protein in one bottle. My kids drink it. They think it's chocolate milk because that's all I buy them. Now I don't buy them chocolate milk anymore. They're drinking protein shakes before school. And they even have an elite version that has 42 grams of protein in one bottle. And to me, it tastes like a chocolate milkshake. It's fantastic. And it has very low sugar. So you have to get creative. So for a day or two, track everything you're eating in one of those apps. And now they're all free, like Chronometer, or even I think MyFitnessPal. Like you can put your foods in and it'll tell you how many grams of protein are in the foods you ate when you put everything you ate in a day. And also the accountability of keeping a food log or a food diary. We eat so much, and I don't know about if you're like me, but as a mom, it would be so much easier for me to put those 2 spoonfuls of mac and cheese in my mouth rather than in the trash and not waste the food. But we do that unconsciously and subconsciously. But if you have to think about everything you put in your mouth and you log it, you tend to make better choices. You tend to eat better. And then you'll start to notice some of the benefit too of the weight loss, but you'll also be able to track your protein and see if you're getting enough. And there's a lot of different ways you can look online to see for your height and your weight and your BMI, like what your average amount of protein intake should be, and try to get to that. Most of us are way under where we need to be, especially in midlife. It's so much more important when we're getting unyoung.
Unyoung.
It's been my favorite line to my kids. Oh, you want me to throw that away for you?
Did you do that too as a dad? Like, here, let me finish that little wedge of a grilled cheese you didn't finish. Or
throw that out for you.
Or the French fries at McDonald's that they leave in the bottom of their Happy Meal box.
You're like, don't throw that out. That's good food right there.
The bagged French fries are that's the parents' fries right there.
That's kryptonite. That's what that is. All right, everybody. This has been a really fun, episode. This month's episode brought to you by These Crazy Doctors and Joe. Thank you.
Our resident skin expert. Yeah.
Our resident expert. Yeah. And by the way, everybody who's still here, Joe is coming back for a full skincare session in
October.
Thank you. I was like, not September, October, where we're going to talk all about skincare and HRT because she is the resident expert. So bring your questions next month. Ask whatever you want. The following month, tell your friends, friends, your neighbors, your aunts, your sisters, your cousins, your whomever. Come to that session and ask your skin questions. And by the way, people in the chat, if you don't know, Winona launched this skin cream like this week. So if you haven't already got yours, you better tell Dr. Green, Dr. Cat, customer service, hey, I need some of this. So add it to my plan. They'll happily add it to your plan. And if you have questions, you know who to ask. So that's my PSA for today. Anybody else have anything before we sign off?
I just want to say thank you, Joe, and appreciate not just what you're doing tonight, but what you've done for us through the year. So thanks.
You're welcome. Thank you.
Go Winona.
Yes, agreed. Thank you, Joe. And also one more
And
final.
you too, Kat.
And Kat, of course.
And her cat.
Kat, our medical director at Winona. Props to Kat. But yes, everybody in the chat, if you need any more proof, look at Joe's skin. I'm just going to keep saying it because person who I'm jealous. I don't live near her, but if I did, I would hang out with her all the time just because you know, the company you keep. So just saying.
And I'm not just a Winona doctor, but I'm a patient too, and I can't wait for my skin cream to come in the mail. I'm waiting on it. So.
Mine's coming too, and Dr. Green prescribed mine, and I don't have it yet, and I'm sitting right next to him. So I'm just saying, when it shows up, I can't wait to do all the things and report back about how much better my skin is going to be from our new product. So
yeah.
Thanks, everyone. It's been fun. We will see you all next month, same bat channel. So join us. We'll see you soon. Thanks, everyone.
Good night, everyone.
Bye.